Hello everyone. Today I have come up with a very new topic. This is a different session. We'll discuss about the antibiotic guidelines for different infections affecting our body. So today we'll discuss about antibiotic guidelines for intra-abdominal infections. So before going to the antibiotics, what are the usual high risk intra-abdominal infections with which patients present to the ICU? They can be like perforation peritonitis, perforation of the bowel with peritonitis, or obstructed strangulated hernia, or gangrenous bowel because of SMA thrombosis, and it can be many and many. So initially, before going to the antibiotics for infections, we have to see what is the bacteriology of intra-abdominal sepsis. What is the bacteriology? In bacteriology, the meaning of bacteriology is what are the common organisms, what are the species causing intra-abdominal infections, and in order, whether it is anaerobes are causing intra-abdominal infections more, or aerobes are causing, or anaerobes are causing, or gram positive organisms, gram negative organisms, which one is causing intra-abdominal infections more, and we have to give empirical antibiotic therapy against that particular organism. So in this bacteriology for intra-abdominal infections, the anaerobes plus aerobes, they cause more intra-abdominal infections than aerobes only. Then comes anaerobes only. Okay. So in aerobes, sorry, in aerobic bacteria, it is mostly caused by E. coli. Okay. Then comes Pseudomonas, then Klebsiella. Okay, and at the gram negative bacilli, these are the common gram negative bacilli causing intra-abdominal infections. Then comes enterococcus, Staph aureus, and the gram positive bacteria. These are the usual gram positive bacteria affecting intra-abdominal infections. Okay. Then comes anaerobic bacteria. So we have to see which are the anaerobic bacteria causing. Sorry again. So we have to see which are the anaerobic bacteria causing these. So first one, bacterioid species. Bacterioids fragilis, then Clostridium, Peptostreptococcus, Fusobacterium. Okay, so this is about the bacteriology in intra-abdominal infections. So again, next we will go to the factors associated with mortality. What are the high risk factors which can aggravate the severity of intra-abdominal infections? So what are the risk factors? Okay, age more than 70 years, any medical comorbs like renal, liver disease, any cancer, malnutrition, or patient is having any immunocompromising condition like poorly controlled diabetes mellitus, or patient is on steroids, or any immunosuppressive agents. Okay, patient is having neutropenia, active HIV infection, or B or T lymphocyte deficiency. Okay, then sepsis, high severity of illness, sepsis, patient is in sepsis, or extensive peritoneal involvement is there, peritonitis is there, peritonitis. Okay. then patient comes to our ICU, or patient comes to the management, our ICU management, after a long time, after delay. There is a delay in the initial intervention, more than 24 hours delay. Okay. So and then any infection source is there, and that source is not debrided, or drainage control is not there. Okay, there was inability to do the initial debridement or drainage control, and the sepsis has worsened. Okay, and the patient is coming to us. And one more thing we have to keep in mind. So when should we suspect antibiotic resistance? Antibiotic resistance. So if it is a healthcare related infection, healthcare acquired infection. So patient has to travel to the areas of high antibiotic resistance within the few weeks prior to the infection onset, or if antibiotics were received during travel. Okay, and if there is non-colonization with antibiotic resistant organisms. Okay, so these are the common risk factors. So now we'll come to the empirical antibiotic therapy. Empirical antibiotic therapy for intra-abdominal infections. So if you are going for single agent regimen, okay, imipenem cilastatin. It has good and intra-abdominal penetration. So this is used as a single agent regimen. 500 milligram IV 6th hourly can be given. Then comes meropenem. This is the very common antibiotic that we use for most of the infections that comes to the ICU to cover the gram negative organisms. Okay, 1 gram IV 8th hourly. Then comes doripenem, 500 milligram IV 8th hourly. Then comes piptas, 4.5 gram IV 6th hourly. Okay, so this is about single agent regimen. So if you are going for a combination regimen with metronidazole. So metronidazole covers the anaerobic bacteria. So if you are going for a combination regimen with metronidazole, we can use like cefepime 2 gram IV 8th hourly plus metro 500 milligram IV 8th hourly. Okay, or instead of cefepime we can use ceftazidime also. So these two are the pseudomonas covering cephalosporins. Okay, so this is about the antibiotics in this is about the antibiotic guidelines in intra-abdominal infections. So when a patient comes with intra-abdominal infections in frank sepsis, antibiotics are a very important measure that we have to administer within like 45 minutes to 1 hour, or else the sepsis can get worsened, and the patient we won't be there reaches a state where we won't be able to save the patient. So apart from antibiotics, there are a lot of other things also that we have to keep in mind when a patient comes with sepsis, like fluid management, use of inotropic support, maintaining a MAP more than 65 or 70, which can give adequate fluid, adequate tissue perfusion, or if the source of infection has to be removed surgically or handled surgically, we have to send the patient immediately to the OT also. So there are a lot of other things also that we have to do if the patient comes with sepsis. So but antibiotics are a very important thing that we have to keep in mind also. So this is about the antibiotic guidelines in intra-abdominal infections. Hope you have got some awareness about the topic. We'll come up with a very new session. We'll come up with a new topic next time. I will try to cover the antibiotic guidelines in different infections affecting our body. So that's it for today. Thank you so much, guys.